members and consumers are going to use the phones that they want to use, and that's totally up to them. We want to make sure that, whatever they're using when they engage with us, it's the perfect experience for them. We have an internal department within KPIT called the Mobility Center of Excellence, which is the group that I lead, and we focus on mobile enablement for consumers, members, clinicians, and where we have close to 9 million members in the system, and almost 4 million of them are registered to use kp.org, which is our primary website where they come and interact with their health record, email their physicians, make appointments, refill prescriptions, view test results, and the volumes are enormous. In 2010, we started tracking mobile traffic to kp.org, and it was about 2%. By the end of the year, it was over 10, and now it's over 14. So it was an obvious, people are hitting our site from their phones and from their mobile browsers, so let's get out there and make it a better experience for them. We really focus a lot on the user experience. So it's a matter of, iOS allows you to control that a lot easier. Android, the fragmentation's a lot bigger. So our goal here is to go native when we go to these devices, so really develop and build in that native platform so that we can optimize the experience as best we can. It's a huge component of our website. We do a lot of our development focused on the user, and we bring them in. We test it. We do a ton of usability tests. We just extend all that to the mobile stuff as well. There's the core capabilities of the My Health Manager feature set, which is the things I talked about, the medical record, which is a series of allergies, immunizations, test results, referrals, and then you have Appointment Center, which is all about making and modifying and viewing appointments, Pharmacy Center, refilling prescriptions, getting medical information about your prescription list, and then the email contact your physician is a huge feature. So that core feature set is what we focused on first for optimization. So when you go to our mobile website, that's kind of that's the nugget of that website. And then when we go to the native applications, we started with that. So it's kind of an obvious core capabilities, and then we look and say, okay, well, what can we add to this that fits with the experience that the person's in. Instead of getting the patient involved with, from a mobile perspective, it's kind of their input into their medical record as it is, right? So it's like you have the physician, the nurse, and the care team interacting on their side, and then from the patient side, you've had the desktop and laptop experience, and now you have their phone experience. You have the apps that they're using, even the ones that we don't provide that they're still using, that's tracking their data, and how do you bring that into that overall medical record? So I think that's kind of where I'm seeing it go is there. And I think a lot of the clinicians that we talk to internally at Kaiser are seeing that as well. So they have all their patients that are tracking their exercise or their condition through either a third-party application, and it has valuable data. So how do we take advantage of that? I know the physicians I've spoken to. They're like, oh my gosh, now I have a patient that's sending me his whole diabetic, every reading he's had for a month. And what they used to do is they'd actually because you can email attachments to our physicians, and so they would track it in a spreadsheet and they'd mail the spreadsheet. So now it's okay, that's too much data, right? But if you have access to it, then you can start training it and pull out certain pieces and have that conversation with the member or the patient. That's valuable. So I think we have probably one of the most secure registrations and sort of authentication and authorization entitlement models that's out there. From a device perspective, I think we let Apple, kind of take care of that, and we have good relationships with them. And their entire platform is becoming much more secure. So even if it's a matter of giving physicians tablets and then ensuring that you can wipe the tablet when you give it to somebody else. So it's like the platform can take care of that. From our perspective, we're just reusing what we've already established with regards to how, registration is one, you can't register on a mobile device. We don't allow that. So you have to come online first and create that account. And then we reuse all the security models that we have, whether it be, authentication in, and if there's something with your authorization rules that happen, we go ahead and stop that experience and then ensure that it gets fixed. So we've just launched, just last week, our iOS native application for consumers. We've done our mobile optimized website back in January. We did an Android app back in January. We did our first native iOS app in July. So we've been sort of having a rhythm of mobile applications focused on consumers coming since mid-2011.